Welcome to Health+Tech, the show where we explore the law that applies at the intersection of healthcare and technology. Your hosts, Andrea, Linna, and Kristen Woodrum, are healthcare attorneys and partners at McGuireWoods, LLP, a law firm of over 1,000 attorneys with offices throughout the United States and the world.
Hi, everyone. Welcome to the Health+Tech podcast. I'm Andrea Linna. I'm a healthcare attorney and partner at McGuireWoods in our Chicago office. And I'm here with my partner, Kristen Woodrum. We are the co-leads of the Digital Health Innovation and Technology subgroup here at McGuireWoods. And I'm thrilled to have Teira Gunlock from First Stop Health on the podcast today. Very excited to get her thoughts because she's a wonderful leader in this space and a wonderful female leader. And so we're excited to have her. So welcome.
Thanks, Andrea. Wonderful to be here.
Good. Yeah. Well, can you introduce yourself and your company and give us some background?
Sure, I'd be happy to. So, as you said, my name is Teira Gunlock. I'm the president of First Stop Health, and we are a virtual care company that serves people nationwide, although we are headquartered here in Chicago. I will tell you a little bit about my background. So my education was in philosophy and healthcare administration, which basically meant that I asked a lot of questions about why healthcare was the way it was, is the way it is, and how we can make it better. And so I think virtual care is obviously a big part of how we can make it better as we move forward. So First Stop Health, I've been there nearly since the beginning, almost 8 years. And we have 3 different products in our suite. So we have 24/7 urgent care telemedicine. You know, when you have a rash and you need a doctor's opinion about what to do about that rash, that's what kind of the urgent care telemedicine can do. We also have virtual mental health, which provides short-term counseling for folks. So if they have some anxiety, depression, grief, and need to talk to a counselor over the phone or over video, we can facilitate that as well. And then lastly, which is a product that we just added this summer, is virtual primary care. So we really believe that in a world that prioritizes things like convenience, on-demand access, personalization, that we're really well poised to help people live better lives.
Yeah, that's awesome. And I'd love to start right there on the virtual primary care. I know you're anything like me, and I hate to say this, but I don't have a primary care provider. And I think there's a lot of people that don't. I don't think I'm alone in that, right? So if, for example, when I got COVID, do you go to urgent care? Where do you go, right? I didn't have a primary care provider. And so I ended up reaching out through companies like First Stop to talk to someone that I could get a hold of quickly to have those virtual primary care issues addressed. So can you talk about how important that is, what its role is, how it emerged? Just give us some background, because I think that's super important.
Yeah. Well, I would say that you are definitely not alone. In fact, you're with the majority of Americans that don't have a primary care physician. And that's really, I would say, when we set our sights on virtual primary care, that is the gap that we were trying to solve, right? So a lot of people and a lot of employers, in fact, know that primary care is a great way to make people healthier. It's also a great way to save on claims costs. In fact, those that have a primary care physician are about a third less costly from a claims perspective than those that don't have a primary care physician. So, the concept of primary care has been around for a long time, and we've known that it can really help reduce spend, make people healthier. But so few people actually have a primary care physician, and that's actually growing as a trend, and it's growing especially among millennials, who are the largest population of the workforce. So there's this giant gap that's out there for us to close, basically. And we think that part of being able to close that gap is by making it easier to use. So our virtual care solution is really designed with the end user and the patient in mind. So it doesn't require somebody scheduling or taking half a day off of work to drive to an appointment, wait out in the waiting room, spend just a few minutes with a physician, and it's a huge cost to them from a time perspective to go do those types of things. And then, of course, they have copays, maybe surprise bills later on. And so we've really tried to break down the barriers that are in the way of people actually accessing virtual or any sort of primary care. So virtual primary care, and the way that we see it, it covers a number of different things. It's prevention and wellness. So making sure that people are getting those recommended screenings and those types of things and kind of on the right track to health. It's chronic care support for things like obesity or COPD, diabetes, hypertension, the list goes on and on. There's mental health care. So a lot of times, a person's mental health needs don't necessarily manifest by a person saying, gosh, I really need to talk to a counselor. It instead manifests as I'm having some stomach issues or I can't sleep very well. And so a primary care physician is really in a great position to serve as a mental health support resource as well, because they can see that whole picture. And then lastly, primary care can support things like, recommended test screenings, and then of course, referrals to specialists as well. I will say that that is like doing those types of things, those pillars are within the realm of kind of traditional primary care. But one of the things that traditional primary care doesn't have the kind of the beauty of that our virtual primary care solution does is that we pair it with our 24/7 telemedicine. So when a person's motivation for healthcare is to seek healthcare is high is when they're sick, so when they have COVID. they go into access healthcare. When they have a rash, that is when they access healthcare. But a lot of times they're going to places where they don't have a relationship and they can't continue that relationship. So we get them kind of when they're sick, when their motivation is high, when they've got that rash, they've got COVID, they need to talk to somebody. And then we parlay that into a long-term relationship. So we're able to kind of get them at that moment when we have their attention and then get them onto a path to better health over time. And so I think that, those kind of pairings allow us to really, move the needle on health and wellness.
Yeah, I think that's so genius too, because I've heard, this was pre-COVID, but so many complaints about telehealth that, I don't see the same provider every time. I want to have that long-term relationship. And this is such the perfect answer to that of one, you get the benefits of both worlds where you can get in touch with someone quickly. It's over your phone. You're not, for me, it's like going to the dermatologist. I have to leave work. I have to drive there. I have to park. And then I have to wait around because the person's not on time. And it's like, I don't have time for this. I'm a busy professional. You know what I mean? And so it's just, putting those two things together and saying, I can see my provider who I like, who I've chosen, and have the convenience of it all. And it's so smart.
Yeah. Well, and it's, part of it was also built on, listening to patients. So one of the things that we often heard after a patient would kind of review our service on the telemedicine side was, this was great. Can you help me now with, X, Y, and Z, my asthma, my, whatever it is. And at the time, years ago, we weren't really set up for that. Right. And so now we've kind of built that to answer their needs as well.
Yeah, as a consumer, I'm sold, and it's been fascinating to see how telehealth has been growing. And I know we've talked before about the mantra, all healthcare is local, and we've heard it for years, and this just turns it on its head. So it's local except when it's not. And so would love your thoughts on how virtual health, including the virtual primary care, fits within the current care delivery system, and in what ways it disrupts or has the potential to disrupt it.
Yeah, it's hard to be more local than your own couch. So it feels like it's taking that an extra step further. When I think about how kind of like primary care grew up and how virtual care has kind of grown up, it's only been in recent times that those things have kind of converged. Like really within the last few years. But a lot of times even with kind of a traditional primary care practice, when they would add a virtual component, it was oftentimes as an afterthought, right? So it's like you come in maybe a number of times, and then that one time you get sick, then you can have a telemedicine visit, right? It was much, much more of an afterthought. And we kind of inherently believe that virtual care is more patient-centered because it respects a person's time. And so we'd prefer if virtual care was the default position. And that is, I think, what's like super exciting about kind of where we are now is that we're starting to see that it hasn't happened yet, but from a general perspective, but like we're trying to be one of the players that really tries to make that shift. And so that it's the default position for care, and that we really respect a person's time. So it's only in instances when we can't provide safe, effective, high quality clinical care that you would then need to come in person somewhere. But, we try to leverage the good parts of healthcare, right? It's like, there's a lot of good that happens in healthcare. And I think sometimes that gets lost in the conversation. I used to work for years in consulting on patient experience. And when it comes to the actual people delivering healthcare, like they're phenomenal. Like they're wonderfully caring people, highly trained people that So often, though, those relationships are discounted by all the other stuff, like all the logistics, all the hurdles that that go along with seeking care. And so we really try to minimize those so that a person can actually benefit from the wonderful people that are in healthcare and the relationships that can be built through virtual care.
And I was going to ask about the biggest drivers for patients engaging in virtual care, obviously convenience and patient experience, but also wanted to ask about the virtual first health plans and kind of those other drivers and trends you're seeing in this area.
Yeah. So when it comes to engaging in care, I mean, I still recognize that virtual care requires behavior change, right? Like it's either change from using in-person care to virtual care, or it's change from doing nothing because in-person care was too hard to using virtual care. So it requires behavior change. And so we rely a lot on kind of the social science and behavioral science on user behavior change, which the kind of preeminent thought leader on that is BJ Fogg. I don't know if you guys have read BJ Fogg. He's got a great book called Tiny Habits out. And he talks about behavior change using 3 different kind of pillars. One is motivation. So a patient has to have some level of motivation to change. The second is ability. So you have to make it easy to do. And if a person's motivation is low, you have to make it very easy to do. If a person's motivation is high, you can make it a little harder to do, but not too hard. And then alongside both of those things, you have to constantly trigger and remind a person to do those types of things. And so our virtual care model is really built with those things in mind. So we recognize where a person is on that motivation spectrum. We try to break down all those barriers, and then we prompt them all the time through both, personal interactions. Like we will have a nurse call a patient and say, "Hey, I care about you. What's going on? Why is it so hard to make this appointment or what may be?" So we have those personal touches as well as automated touches as well. And so I think that's, because we recognize those things, we've been able to really get high engagement. So we typically lead the industry in utilization and those types of things. And that's also because we care about it and we align our incentives with employers so that they are also, working with us to design the right communications to get people to, in the fold.
Yeah, some of your statistics are very impressive. So thanks for touching on that.
Yeah. No, and that's so smart, because I think what you were mentioning, like, why is it so hard to make this an appointment, right? And we all fall into this, this task has been on my to-do list for like 6 months, right? To make this appointment or whatever. So I can imagine for everyone probably has that problem, right? And to be able to have someone proactively reach out. I've never had anyone do that for me, to have my provider be able to do that. I think that's huge. And it reminds me too of just how important all this is to eventually get to the place of value-based care where we can make sure that we're actually taking care of people on the front end and getting them engaged in their care so we can end up saving money on the back end, right? And get away from this fee-for-service model.
Yep. Yeah. And I mean, so one of the things that we try to do is, as I said, like align our incentives with our employer clients, and we actually guarantee return on investment for our services. So we know, every time that a person uses, say, for example, our urgent care service, we calculate savings based on them coming to us versus going to, say, an emergency room. And so we're able to align our incentives with the employers because, the more we can kind of divert from that traditional claims processing, which has so much additional costs and kind of humans checking claims and all those types of things, the more we can kind of divert from that traditional model, the better off basically everybody is. The better off employers are because they're paying less. The better off the patients are because it's a better experience. So there's a lot of good that kind of comes from diverting those folks.
Yeah. Well, and like you said, it's behavior change because pre-pandemic, I know I thought like, if something's wrong, I just go to the urgent care because I live in the city and there's 100 urgent cares and, the block around me. But now after COVID, it's like, I can reach someone on my phone, right? I've got a provider there. And so many people for the first time during COVID had that virtual interaction with the healthcare system that they wouldn't have even thought about before. So it opens up a whole new level of behavior.
Yeah. And it's interesting. I mean, it certainly opened it up for a lot of patients. It also opened it up for a lot of physicians who were forced kind of to use it for the first time and then discovered the great benefits of virtual care and how easier it was than perhaps they thought it might have been. So that's been also a wonderful thing too, in terms of kind of recruiting. We have our own physician network, so being able to recruit doctors, I think has been slightly easier post-pandemic because there's just a greater level of acceptance among the clinical community as well.
What are you most excited about in terms of the future of First Stop or virtual care?
I would say that I'm excited about a lot of things. I'm excited, I wake up every day knowing that our service makes a difference in people's lives. And that's kind of continually a driving force in kind of why I love doing what I do. I would say from a kind of general digital health space, I think that, I think a lot about trust. And so there was a lot of kind of articles that have come out over the last year or two about the crisis of trust within healthcare. And I think that actually digital healthcare can help with that. So if you think about trust being like built on I think it was a guy named Charles Green who came up with the trust equation. So it's credibility, reliability, and intimacy. And then you divide that all by your self-orientation. But all of that, basically, like to have those interactions, you have to make it easier. So digital healthcare makes it easier for people to kind of get in and to have interactions that are reliable, credible, that are intimate because we allow for more time with patients, and a little less kind of focused on what's best necessarily for the health system or the physician, and thinking a little bit more about the patient. So I think that there's a way that we can use this moment within digital healthcare and the kind of boon here to really build trust back with populations. And I think that that's a really exciting thing.
That is awesome. Well, I'm glad this is recorded because I should have been taking notes. You've got so many great insights. I love it. Well, thank you so much for being a guest. This was really informative and really helpful. So we're going to be posting this on YouTube, on LinkedIn, on our social media pages, and then it will be on Apple Podcasts and Spotify. So thank you everyone for listening, and thank you for being our guest.
Thanks.